being used as target practice, lying on your discharge summaries, all the way to starving someone, right, going as far as poisoning someone with a drug overdose rather than to just admit your own mistake. This 4-part series, I reveal to you very real experiences pulled straight out of a horror movie of my experiences with Canada's healthcare system. Just a disclaimer. Before we get started on the actual video, I just want to reveal my intentions for uploading this series in the first place. The purpose of making this series is not to backbite, criticize, or insult Canada's healthcare systems, the wonderful medical professionals out there who are trying their best to save lives, but rather it's so that if this video ever goes viral, raise awareness and hopefully fix some of the issues within Canada's healthcare system, and maybe, just maybe, I can make my life and your life just a little bit better. To those of you who love the horror genre, whether that be R.L. Stine's Goosebumps, whether that be Pennywise the Clown, put together this 4-piece video compilation series about my negative healthcare experiences as a chronically ill patient in a particular hospital. Lakeridge. Lakeridge. These experiences are so absurd, you will literally think I've made this up and I've pulled it straight out of a horror film. But believe me, trust me, lying is haram in Islam. These stories are very real. So this took place about, I want to say, 6 to 5 months ago in Ramadan during the last 10 nights. Basically leading the Tarawih prayers. I notice I start feeling my chest starting to tighten. I don't know what's happening to me. I start panicking. My heart rate starts going 50 miles an hour, and weakness, fatigue, tiredness. So immediately I run upstairs and I grab what's called an oximeter, something like that. It's like a probe that you put on your finger, and it measures your oxygen saturation levels. I noticed that my oxygen levels started dropping. I drank a full glass of water. I didn't know what was going on. Oh yes, Nafil, anyway, I'm not feeling well. I'm going to take a nap, inshallah, in the morning. Everything will be all right. Now, the same thing happened, except I want to say to an extreme degree. After my head suddenly started to spin, I felt really dizzy. I felt like my limbs suddenly became numb, and my chest became very tight, and my heart started racing, like really, really, really fast. You get what I'm saying, right? As if my life was being sucked out of my mouth. My lips became dry, my whole mouth became suddenly very, very dry. Think of a dehydrated crocodile in the Sahara Desert. So bad that I felt like if I were to get up, stand up, I would pass out. And I also started telling my mom, people around me, that, call the ambulance, call an ambulance, I don't feel well. Call the ambulance, I don't feel well. But I was just not feeling it. Like, all I could think of was, I'm dying. That's it. These are my final moments. I kept saying, La ilaha illallah, subhanallah. So we basically pull up to the automatic large glass sliding doors of Lakeridge Health Ajax. And as the doors open, I enter the hospital. I look around me and I see the hospital is basically packed. Hospitals here in Canada and many parts of the world use something called the triage system. You're in a electronic health record, why you're here, the reason you're here, your symptoms, and based off of these symptoms, the nurses decide who gets to be seen first. If someone is having a heart attack, that patient will likely be seen before someone who broke their pinky. And someone who broke their pinky will likely be seen before someone who has a really bad cough, if you get what I mean. So I enter the hospital and I enter my symptoms, and because I was feeling so many weird symptoms at the same time, I did what any sane person would. No, I'm just kidding, no. I entered the most severe symptom, and the entire time I'm basically shivering uncontrollably. I don't know what's going on with me. And the nurse said, okay, don't worry, we'll get you all checked up. I was almost certain that my vital signs would be messed up. But no, my vital signs were shockingly not messed up. They were all normal. Blood pressure was normal, temperature was normal. Everything that the nurse checked in the assessment was shockingly normal. They found nothing. I went back to the waiting room with a urine sample. Wait for about an hour until I get called into the actual emergency department. I wait for about 30 to 40 minutes, and another nurse comes in. I basically have to tell her the entire story again. Me being a complex medical patient and having a past medical history, I kindly explained to her that I have had these symptoms before. Play these games! Explained to her that I've gotten admitted to the hospital because my hemoglobin levels and iron levels were really, really low. My hemoglobin levels were 151. Just to let you know, the normal is 150. The nurse acknowledges that, hemoglobin is okay, and I then ask her about my iron levels, in which she looks at me and she responds, it's fine, your iron is fine. If your hemoglobin is low, then your iron would be also low. I explained to her that I had an iron transfusion last time, and that's basically what fixed the problem. She basically said, okay, I will basically talk with the doctor. Actually, the doctor walks in. Now, this doctor, he is muscular. He has a muscular or sort of large built black doctor, maybe Nigerian, maybe African, bald, no hair, wears glasses, round complexion. He enters the room and I am relieved to see him. Finally, doctor, he can have an explanation of what's going on, what's going wrong with me. He looks me dead in the eyes, crosses his arms like this, and with a blank expression. Hi. Now, I'm a kind of person that reads people a lot, and what I read off of him is that I was wasting his time. He started tapping his foot, what he basically explained, or he told me to explain, like, what happened. Again, I tell him the entire story of what happened and why I was here in the first place. And he basically was like, well, I checked your blood work. It's not an emergency. You're good to go home. These were real symptoms I was feeling. And knowing my complicated past medical history, I know that I need to be taken seriously. Because the last time I didn't be taken seriously, my hemoglobin levels, which is blood levels basically in a sense, dropped to 3. I immediately interrupt and I basically explain to him and I say, I understand, but these symptoms I'm feeling, they're very real. I couldn't breathe, my chest was feeling tight and my lips were feeling dry and I was shivering. My heart was racing and I was sweating and I was feeling weak and all this. And I just keep going on and on and on. And the doctor, he is not feeling it. He's tapping his foot, arms crossed, like it's as if something's irritating him. And then he basically just looks at me and he goes, what do you want me to do? Okay, yeah, go see your family doctor. Not an emergency. At this point, I was basically fed up. But me being a polite person and not wanting to start a fight, I basically say, okay, can you at least, refer me to a internal medicine specialist? Or can you order me an iron transfusion? Because I know myself, right? These symptoms have happened before. So, alhamdulillah, I'm in this situation to advocate for myself. And this guy just goes, no. No, I'm not. Go home. Go see your family doctors. Look at him. I'm like, okay. Can I get my discharge papers? And as I look at my discharge papers, I read the discharge summary. A discharge paper is basically when a doctor summarizes your medical visit. It contains anything he prescribed, any medications you need to continue or discontinue, any treatment plans, your vitals. It contains all the tests done. It's basically a summary of your whole visit. It basically says, thoroughly assessed patient, and I did a physical. It said something along the lines of abdomen was tender to touch. Wasn't tender to touch, was soft, and whoa, what the frick? You didn't even do an abdomen exam. Like he didn't even look. He didn't even ask me to lie down on the examination bench. Not like wasting your time. This is not like I understand you're an emergency medicine physician and you have people who are dying, bleeding out. No. This is bad medicine. Like the least you can do, had you had me lie down on the examination table, had you actually did a physical, had you actually listened instead of stomping your feet, looking me in the eyes, and just dismissing everything I said, I would have maybe felt satisfied. And I even saw the blood work on the discharge papers. He said everything was normal. There were a bunch of things I saw that weren't normal, like I'll give you some examples. Ion gap was not normal. Liver enzymes were elevated. And there were like a couple other things that were not normal. Anyway, maybe those enzymes are not normal, but they're not something to be concerned about. But still, I'm just trying to let you guys know that this doctor did not do a good job. Down the line, everything is going smooth until suddenly the same symptoms attack. Again, I was rushed to Lake Ridge Health in the emergency. And because of this horrible experience I had, I was basically praying that I didn't have the same doctor, because I don't want this doctor. Like, I just don't want him. And lo and behold, it's that same doctor. And I was pretty disappointed to see him. And I'm pretty sure he was also very disappointed to see me. Anyway, he goes, I recognize him on the spot. I'm like, oh, hi, yeah, you, I remember you. He doesn't budge. His facial expression. Yes, how can I help you? Explain again that, yeah, I know that you sent me home last time. You said it was an emergency. And all these symptoms, they started happening again. So he goes, "Did you see your family doctor?" I'm like, no, I didn't see my family doctor. But these symptoms started happening suddenly, and I thought it was an emergency. And I explained to him, like, I know you may be thinking I'm wasting your time, your money, and your resources, but to me, these symptoms are real, and I did felt them. And this is the second time that this has happened to me. So what's going on? And the doctor goes, I don't know. It's not an emergency. Go home, see your family doctor. Hey, can you please at least refer me to internal medicine or, iron transfusion? And he goes, no. Family doctor, go to your family doctor. Your family doctor will do all this. Anyway, time goes on, and I develop an infection on my J-tube. A J-tube is basically a feeding tube that's normally inserted when you're a child or at the time of birth if there's some sort of blockage or damage or defect in your digestive system. I've had one all my life. And it was swollen, it was infected, and it was really hot, and when I touched it, it was giving me pain. When I walked, it gave me pain. When I laughed, it gave me pain. When I talked too much, it gave me pain. When I breathed too much, it gave me pain. Like disgusting, losing pus and discharge coming out of it. It was nasty. The area just kept getting worse and worse. So I had no choice. Although I didn't want to, I had no choice but to go to the emergency department. Again, assessment room. And I wait for the doctor. Lo and behold, it's that same doctor. Immediately, I just lifted up my shirt and I showed him that, look, this is infected. It's swollen, it hurts, pus is coming out. I talk, when I breathe, when I do anything, and it's giving me pain. And I lifted up my shirt and I showed him. And this guy, he didn't even bat an eyelid at me. Okay. I'll order you a swab. Akhi, aren't you gonna look? Aren't you gonna check? Aren't you gonna expect? Aren't you gonna examine? He doesn't even look at the location. He just looks me dead in the eyes. And it felt very cold and uncomfortable. Maybe I'm the sensitive one. Maybe, maybe I'm overreacting. But what I felt was not normal because I've had so many experiences with doctors, nurses, nurse practitioners, physician assistants all my life, and I know what good medical care is. I'm not demanding too much. All I'm asking you to do is hear me out, listen respectfully, do a physical exam, answer and address any of my questions and concerns. A nurse comes to do my vitals and, take blood work and stuff. Before anything, she notices that I was wearing a shirt that said practical nursing on the back. And she goes, "Are you a nursing student?" And I go, yeah, I am. How'd you know? She's like, "Oh, yeah, your shirt. And then she also explained that, I also went to Centennial College. And this nurse was so friendly. And just by her communicating with me, just by her being compassionate and caring and, just interacting with me just made me feel very calm, very comfortable. And my already depressed mood, I was already feeling so much better. Keep in mind that I was in so much pain. The pain was like on a scale of 1 to 10, I'd say it was like a 6 out of 10. And he makes me uncomfortable. He doesn't listen to what I'm saying. He didn't even do a physical exam. He lied on his discharge papers. And as I'm saying this, subhanAllah, the nurse's face, I could tell, she was frustrated. "Oh, is that the case? Don't worry, yeah, she started siding with me and she started supporting me and advocating for me. And she says, I'm going to go complain and hopefully I think she said something along the lines of have him have him get suspended or in trouble or something. Just made my whole visit so much better. So shout out to Melissa for being a very great and caring nurse for me in my darkest times. Thank you so much. At this point, I teared up and I basically from the bottom of my heart, I made a dua for her. I said, Ya Allah, Ya Rabbi, guide her. Ya Rabbi, guide her. She helped me. Ya Rabbi, guide her. She helped me. May Allah subhanahu wa ta'ala guide her to the truth and the deen of Islam, inshallah. I hope you enjoyed the story. This was a bit of a long one, but the purpose of my story is not to backbite, not to pick on anyone, but to basically put this video out there so if any of you are doctors, nurses, healthcare providers, or know anyone who works in the hospital, to just learn from my negative experience and don't ever, ever, ever treat your patients like that. You don't know what we're going through. You don't know the reason we've came here. Yeah, sure, maybe you have annoying, crappy patients that come to the emergency department for no reason whatsoever. But most of us, we're here for a reason. You think we want to stay at an emergency department where there's people coughing, sneezing, beeps, loud noises, people throwing up everywhere? Do you think we want to be there when we could just be snuggled in our beds eating Doritos, playing on our Nintendo Switches? I really hope that anybody from Lake Ridge Hospital who works there sees my message, sees my video, and takes action. Assalamu alaikum wa rahmatullahi wa barakatuh.